My name is Mandeep Dhaliwal, and I am the Director of Health at UNDP. I lead the global practice. As part of our work, we work with governments, civil society, UN partners, and others on digital health in over 90 countries. Our work is very much about a people-centered, rights-based approach to digital health and digital transformation of health systems. And I'm really pleased to be here today with a very illustrious panel. We spent yesterday really unpacking a lot of the technology and the transformative power of technology for health systems and health outcomes. Today we're going to get into the people side of things. How do we responsibly, ethically use and unleash the transformative power of AI and digital solutions for better health outcomes? And I think anybody who saw that video yesterday on AI, there was a very powerful message there that it's really up to us how we design, deploy these technologies. And we're going to unpack today, how do we do that in ways that are ethical? What are the issues that we need to address? So experiences, examples, what are the harms, what are the risks, and what are the real possibilities and opportunities. So with that, let me welcome the panel. We've got some very illustrious panel members up on stage. We have Professor Meg Davies, who you heard from yesterday, Professor of Human Rights and Digital Health, University of Warwick. Meg, please come up and join us. Ms. Jerome Limo, who's the Executive Director and Ambassador for Youth and Adolescent Reproductive Health Program in Kenya. Jerome, please come up and join us. Mr. Osama Manzar, he's the Director and Founder of Digital Empowerment Foundation in India. And online, please, Osama, can you please come up and join us? And online, we have Professor Gufran Mukti, who is the President, Social Security Administration for Health from Indonesia. And hopefully we're going to see him online. So we can just speak, and they're controlling them from the back. We'll wait for Osama. So let's get started. Digital technologies and AI hold the promise of transforming health care delivery and health outcomes. And we must remember that, because we hear a lot about digital AI for health systems, but really the ultimate objective is to improve human health and well-being. So I'd like you to talk about, we know that there are significant ethical and human rights concerns associated with the growing and sometimes unchecked utilization of digital technologies and AI, which can exacerbate existing inequalities, inequities. So let's talk a little bit about the major threats that technology poses to society, as well as the key barriers to accessing. Sometimes we talk about these technologies like everybody has access. They don't. There's a massive digital divide. There's an energy divide. There are a lot of issues that prevent people from accessing as well. So what are the major threats that technology poses to society, as well as the key barriers to access? And let's talk and unpack a little bit from the perspective also of the gender gap and the needs of marginalized populations. And I'm going to ask Jerome, I'm going to ask you to reflect on that first question.
Thank you so much, Mandeep, and good morning, everyone. I think I'll just start by really painting a scenario, and I want all of us in this room to imagine a young girl deep in the rural area, in the village, who cannot access any online health information because they don't have access to a smartphone. Again, we imagine that everyone has a smartphone in this day and age, but that's not the case. And she doesn't have internet, so she can't utilize all these amazing things we are talking about this room. Or a woman who needs medical advice but is scared to use a digital tool because they have personal data to share and they don't know what will happen to this data once they input it in an app. Or really a transgender person who's scared to utilize a tool because will it actually identify my identity or be able to help me with my very specific and different needs? One of the things I'm really thinking about is stigma and economic factors. One, so many people really are scared of utilizing these apps because they are not sure if this app will be able to give them the curated needs and address the issues that they have. But also economic factors, digital divide, like you mentioned, lack of smartphones, lack of access to really good internet that can be able to support the bandwidth that is required to utilize these apps. But also really highlight the need for the issue around systematic issues. We have so many people who are not able to utilize online spaces because of laws and policies that bar them from utilizing these spaces. So just to mention but a few, I mean, it's majorly lack of access to internet, smartphone, but also digital literacy. It's one thing to go through your phone, but it is another thing to be able to properly navigate a smartphone or a digital app and to be able to properly utilize it. Yeah.
Thank you very much. Let me ask you, Professor Gouffran, thank you for joining us online on a Saturday morning from your office. Please, the same question, share some reflections from your perspective. No sound, sorry.
Yeah, now it's okay.
Perfect, thank you.
Can you?
Yes, we can hear you.
Yes,
Yes.
of course
Well,
that, in Indonesia, the major challenges posed by digital health technologies and AI in society, particularly, in the remote area, of course, is inequalities and barrier to access. That digital literacy also is not 100%, especially in remote areas and also in rural, very, very far away from Jakarta. So unequal development of infrastructure poses a significant barrier. Therefore, I think it is very necessary to improve, the infrastructures across the country because we have around 17,000 islands, something like that. And the context of artificial intelligence also, we still have limited number of skilled human resources in this field. So I think availability of AI professional and developers need to be improved. And of course, then the gap, especially access for marginalized group who are frequently underrepresented in high technology sectors. It is really, we should think that although now the government is trying to fulfill that gap, and overall, while digital technologies, AI, have a great potential improvement in healthcare system and other sectors, the existing challenges and related to digital literacy, infrastructure, and human resources need to be addressed and ensure that these technologies can be enjoyed equitably by all members of society without increases the existing inequalities. I think that is our challenges. Thank you.
Thank you so much. And I think both you and Jerope have highlighted systems, infrastructure, literacy as really, really important things, and the existing inequities, both geographic, population, that make it challenging to benefit from these new technologies. There's also an issue around there are social inequities. And there are ways to design technologies that are not happening at a sufficient scale now. So technologies designed by the people for the people. And maybe we'll get a little bit now into, Meg, for you to talk about, and you touched upon some of this yesterday, what are the potential ethical risks and violations of human rights posed by these technologies?
Thanks so much, Mandeep. It's really a delight to be here with these wonderful experts to talk about these issues. And there are so many different concerns, and I think my colleagues have highlighted some of the really crucial ones that shape access to the fundamental human right to health. But I want to just zoom out on a larger kind of trends that I think we also should be thinking about in regards to technology, which is the politicization of health data. And some of us woke up this morning to news that the US Center for Disease Control was systematically removing websites with data on so-called gender ideology, pages on HIV, on the health of sexual minorities, on women's health, something called the Social Vulnerability Index, which is data used to identify populations most vulnerable to disasters. And, you know, for many of my colleagues, this is a battle you've been fighting for years in other countries because health data is often suppressed or warped to shape political agendas or shaped by discrimination in countries or criminalization. And governments, we know, often suppress data on key populations, on women's health, because it's inconvenient to acknowledge the reality of diverse groups. Something I explored in a book, The Uncounted, in which I looked at how lack of data on key populations fuels government denialism. Research is not done on their health needs, and services are not prioritized, and this reinforces the lack of data. And that can then lead to warping of prioritization, because if you have no data on LGBTQ plus communities, it's easy to deny that they exist or that they have urgent health needs, and to deprioritize funding for those programs. So when we see the CDC in the US doing this, and the CDC is a funder and a partner in many other countries, it's concerning to think about what the impact of this might be on data globally for communities that have had to fight to assert their existence and their health needs for quite some time. And so I think we have to think both about the threats and the existing harms, because when we feed this warped and inaccurate data into algorithms that might also be shaped by inaccurate assumptions because of the lack of diversity among those who write the algorithms, this can lead to misdiagnosis, to mistreatment, to other harms, because you have AI that doesn't recognize the health needs of women, that doesn't recognize people's diverse skin pigmentation, and therefore you have something that actually becomes actively an instrument for harm. So just to emphasize the point I made yesterday, I think we need to think both about threats, but also about actual harms and accountability at both global and national levels for those harms. Thanks.
Thanks so much. And I want to unpack the harm thing before I come to you, Osama. So there's environmental harms. We're hearing more and more about the climate and carbon footprint of these technologies, something that we haven't really paid attention to. So that's one area of harm. The other area of harm that there's more and more research appearing about is mental health. And we're seeing that the later the introduction of technology in young people, the better their mental health. And so the harms of these, these algorithms, the social media, these technologies on young people is something that, we need to really think about more. The other is a broader societal harm around trust. And I think we've seen during COVID how the erosion of trust can, that's kind of rolled out through our smartphones, through social media, the impact that has on public health. And particularly the health of marginalized communities. So maybe we'll pick up some of these threads in our conversation and from our colleagues when they speak and ask questions. But Osama, over to you to really talk about the potential ethical risks and violations to human rights.
Yeah, I mean, we have been living with the digital technology for about 30 years now. And there are three very strong observation is that we started our life with where we use digital, but now digital is using us. So there is a difference between the two. Because there is no other democratic technology as internet, but actually technology hasn't changed as far as the internet is concerned, but it has been appropriated by the people by only 5 companies. So we all are appropriated by those 5 companies on the internet to behave the way, and our behavior is observed. So that's one very strong point. The second point is the ethical issue is not a technology issue, it's a people issue. We have to make the policy in such a way that we make the technology work ethically,
That's what we saw in that video yesterday.
Yeah, exactly. So that means intentions are important, and your principles are important, your constitution is important, and how you use the technology. And the third is, I will give you as an example, in India there is about a few 100 million people apply for basic job, which is called NREGA, National Rural Employment Guarantee. It's 100 days basic work that you demand and government has to give. All those people are the poorest of the poor. It's 100 days minimum guarantee that you get. Now they are being asked to do their attendance from the field of digging to, on a smartphone, on a particular app, that you, whether you work that many hours. So, work in, work out, and with the photograph and geolocation, right? If you don't do that, the algorithm will treat that you were absent and therefore you will not be paid. Whose role? It's not a technology role in this one. It's the intention of who is employed you, who is asking you to give government, and whether you should be asking those kind of people to give government. Attendance taking is a company's role or government's role. It's not my role. I'm coming to my work. It's your job to find out whether I'm coming to do work. But that's one simple example. The same thing can happen in various kind of rights. So right to technology is actually needs to be designed for social rights and human rights, right?
And environmental rights.
Yeah, absolutely. And if not environmental right, at least environmental consideration. For example, I am told that one large language module leaves as much carbon footprint as 360 times taking around by an aircraft of the globe. That's a huge carbon footprint. How are you going to have that technology, that kind of policy? So those are the issues that we need to really be very aware of. I will have some couple of more points, but I'll come back.
Come back, okay. So Meg, you started touching on this already, but maybe before we move to the next block of questions, do you want to say a little bit about root causes and drivers of some of the challenges that we've talked about today, so far this morning? And what are the health implications?
Yeah, I think, you really highlighted some of this issue of AI is really a big corporate business, right? This is not something that's a small local kind of startup thing. It requires huge concentrations of capital and infrastructure. And so right now we have a situation in which I think it's three companies command 70% of the global cloud market, and they're all located in one jurisdiction in the United States. So what's the implication of that in terms of the extraction of data from low and middle income countries, how that's being used to develop algorithms that are then sold back to those countries at a profit? We fought a long time for access to medicines. Thailand, as I mentioned yesterday, is one of the few countries with compulsory licensing. How do we begin to think about access and ownership in an economy that is so profoundly unequal, right, and that is replicating existing histories of colonialism? And I know there's a panel this afternoon on digital colonialism, and I think that's so welcome in a global health setting that we began to have that kind of conversation. And I think we need the UN to create spaces for that kind of discussion, because we can't ask low and middle income countries to do it on their own. They need to have some space and some support in which to reassert their rights to data that is used to improve and strengthen their own health systems.
Thanks so much. So really unpacking some of the political determinants around inequality. So we've had, I think, some really, really interesting reflections on everything from, different determinants of access to the need for stronger regulation, and laws and policies, the need to address data gaps, algorithm biases, address the digital divide, and really strengthen data governance and data security. Let's go on a little bit now to the opportunity, to the audience. So clearly, I think we've all gotten very good at unpacking what some of the threats are, and what do we need to do to have more effective application of digital technologies and AI to advance universal health coverage and the right to health for everyone. So what do we need to explore in terms of key principles, strategies to promote equity and inclusion in the use of health technologies? How do we measure this? How do we safeguard against some of these key threats? So let's start with you, Jerome. The digital divide is a major challenge. You brought that up. How can we narrow this gap, particularly in the global south, and among marginalized populations? What are your thoughts?
First, I think access to technology really means nothing or little if people are not literate. I'll really put emphasis on that. So investing in digital literacy is essentially very important. I have the opportunity to sit at the advisory board of the Digital Health Rights Project back in Kenya. And reading the report and listening to what the communities are saying is, I have a phone, but I don't know how to use it. I don't know where to go and get correct information. I don't know how to differentiate what is right and what is wrong. So digital literacy will play a huge role in ensuring that people can be able to properly navigate all these spaces, but really development of very inclusive spaces, apps, websites, all these things are very essential. A lot of times we say back at home, back in Kenya, is that these apps are designed for urban users. But when you go into deep rural areas, people don't know how to speak English. If an app is in English, then automatically it leaves a huge percentage of people out. So how do we think about local languages that, will ensure that everyone can be able to utilize it? Expanding the digital infrastructure. I mean, again, ensuring that internet and just smartphones are accessible even for people in rural areas. I like Osama's example. I mean, what if I don't have a phone? How will I log in and say I actually went to job? What if my phone died? How do I log in and say I actually did the 12 hours you want me to do so that you pay me? So ensuring that digital infrastructure is an actual thing is important for you, for governments, for partners to invest and put resources in it. And really, lastly, is sort of cross-sectional efforts and partnerships. Health is not a one person's job. It cuts across different sectors. It's ensuring that young people in school who use computers and laptops have access to apps and spaces where they can be able to access information, and that requires Ministry of Education to work with Ministry of Health, to work with communities. So ideally, it cannot be an app developer working alone. Otherwise, you'll miss out on the actual needs of these people who are going to be end users. So creating a space for us communities to sit in those developing rooms, to give you ideas, to tell you about the language, the color, how do I navigate this, will ensure that your app is not just an app, but it's an inclusive app. It's an app that actually addresses the need of the end user you want to use your app. Yeah.
Fantastic. I think some very, very useful, practical tips on how we can make technology more appropriate, more accessible, and more effective. Okay, Osama, what experiences and lessons can you share in terms of protecting patient data and digital rights, which we might apply in different countries?
Yeah, I also want to, dissect a little bit about the access issue in the sense that people need access, whether you go to hospital or at home or something. Now, access has actually three parts: digital divide and access. Meaningful access. Do you have just access or do you have a meaningful access? Meaningful access comes with literacy, but do you have just digital literacy or you have a functional digital literacy? Can you operate how to make payment? Can you operate how to book an appointment? Can you operate how to use the public infrastructure or something? So that's very, very important. In India, we have about 52% people connected to the internet, but 48% are not. But out of 52, almost 30% or 50% do not know how to use internet, or they use once in 1 year or something like that. And one example, concrete example, in India, 350 million people make online payment last year, right? Only 122 million people were from rural India who could try online payment out of 900 million population of rural India. So there is a perspective, so that's very, very important. The third thing is, public health systems or any digital needs to relate with public access point. It's very, very important. You cannot treat technology to be individualized for public service, and health is a public service. You cannot. You have to think how is all your hospitals, all your health centers, all your frontline health workers, are they digitally trained fully to serve their community through their digital infrastructure for health service? That's very, very important. And the third part is, you cannot make digital infrastructure or digital way is the only way through legislation. You cannot say that you can only do online payment. I don't take cash. If I don't have an online payment system, how can you not take cash? I have the currency. I have the. So that's like human rights violation. And you say on the one side, you have right to health, but the second line say you don't have access to health because access is based on digital. And now you will say digital is based on AI. I mean, you keep on appending the level of divide all the time. You know, earlier digital divide was something else. Now digital divide is AI divide, actually.
Interesting. I'm also thinking the difference between, the challenges in regulation between privately provided healthcare and public. And that's a whole other domain increasingly in countries. It just India made me think of that. Many, many people are now accessing in the private sector. And how is the digital aspect of that going to be regulated? How are you going to ensure safety and effectiveness there? Okay, let me come to Meg, and then I'm going to come to you, Professor Gouffran, in a minute. What do you think are the key principles and ethical standards that we need to adhere to ensure ethical rights-based design, application, and access? I'm going to add access because I think it's an important part of the conversation to these health technologies.
Thanks, Mandeep. So along with Europe, I'm involved with the Digital Health and Rights Project, which is the largest international study of digital rights in health. We've now spoken with about 600 young adults in Bangladesh, Vietnam, Colombia, Ghana, and Kenya, using a participatory action research approach in which young adults and community-led organizations that are part of the study participate in both doing the study, analyzing the results, using them for advocacy and training, and then governing the project. So in each country there are advisory teams that elect a representative that sits on our global board. And so for us, these fundamental human rights principles of transparency, accountability, non-discrimination, which always sounds nice and it's so much harder to do in practice to really institute non-discrimination in a meaningful way. Meaningful participation so that communities who are part of a study project should actually have an opportunity to participate in analyzing and using that data, should be the owners and custodians of that data, and should have a voice in digital health governance, in being consulted on strategies, policies, priorities, in addition to the design, but also the actual decision-making needs to have much more democratic participation. In our study, we've really been looking at both challenges and benefits within the formal health system, but also more broadly outside the formal health system. Because I think when we talk about digital health, we think just about the technologies used in the clinics. But for a lot of the young adults that we talk to, digital health is social media. It is TikTok, it's YouTube, it's Instagram. That's where they go to self-diagnose, to get information, to get peer support, often because they feel judged in clinics, despite how many years of training and sensitization, we still have a challenge there. And so I think we really also have to think about how do we engage in social media to promote the fundamental human right to health. That's very challenging, but I think we can't turn away from that challenge. Thanks.
Thanks so much. So let me come to Professor Gouffran. How can we ensure robust safeguards for data protection while unleashing the potential of data to drive health innovation? What role does the government play in building public trust in AI-driven healthcare?
Yeah, I think it is very important that to keep data protection, strong while supporting innovation in health sector. We must balance data security and it is used for the public benefit. At BPJS Kesehatan, actually, we have taken the step to ensure that data help to improve services without risking national health insurance members' privacy. So one of our innovation, for example, we have what we call it self-service business intelligence, which allows BPJS Kesehatan staff to access and analyze membership and claim data independently without always needing help from the IT team. And this help speed up and improve database decision making. And we also release the sample data JKN, our national health insurance data, which contain detailed, JKN or National Health Insurance transaction data, which over 102 million data, which this data is open to public, but has gone through a masking process. So where personal information has been removed, this also ensures that no one can use the data to identify specific individual medical history record. And the other aspect, which is very important in building trust, we apply personal data protection strategies based on at least four main elements. Namely, first, the people, raising privacy awareness among employees and also partners, such as healthcare facilities, primary care, hospitals, so that they understand the importance of keeping personal data confidential. In terms of the policy, number two, creating guidelines and include internal policies on personal data protection, a privacy notice to inform participants without or at least about how their data is used, and guideline for working with external parties like data controllers, data processors, and also joint controllers. In number three, in the process, review contract or agreement with partners such as healthcare facilities, hospitals, also vendors, to ensure they follow personal data security standard. And also number four, the governance. As a data controller, BPJS Kesehatan must have a data protection officer, to maintain public trust and support transparency and accountability. For example, now we apply what we call it iCare JKN, which very convenient for the patient and the doctor. Patient in Jogja, for example, if they use iCare JKN, they know the own historical medical record. But the doctor in Jakarta maybe be able to access of this iCare JKN, the personal data history, health history of a patient, but the patient should have informed consent. Without informed consent, the doctor in Jakarta or other doctor will not be able to access this. So there should be a permission or informed consent. So that is some of our important to building the trust and protection of the data of our members of National Health Insurance. Thank you.
Fantastic. I mean, very comprehensive. So everything from very strong regulation and protection of data to creating literacy, not just in terms of literacy in the people who use the data, how they need to protect the integrity and the transparency of the data, but also in the end users, so they understand and they trust the system. I think it's a whole, when we say digital literacy now, I'm thinking it's not just the end user, it's also everybody in that entire chain. And literacy also on the ethical and the human rights aspects, so that people can actually safeguard data in a very rigorous way. It's a heavy lift, it's a lot to do. And I'm gonna ask, we'll come back to this in the close, I'm gonna open it up now to the audience. I'm sure there's lots of interesting questions and experiences to share. And then we'll come back on reflections from the panel on, what does it take to have effective regulation and governance of digital technologies for health. But I'm also going to ask people to think about, how do we do this with the private sector? You have growing private sector engagement and provision of health across the world. How do we regulate? How do we work with the private sector, and how do we bring them into this this whole sort of process that you've described, Professor Gouffran, to build trust, to have robust safeguards for the data and for the use of the digital technologies. So let's see. I'm going to need some help now. If people are coming up to the microphones, if you could just introduce yourself briefly, if you have a question or a comment, or you'd like to share an example. Do we see anybody, or is it too early in the morning for people on a Saturday? I don't know. Okay, please.
Hello, good morning. I'm Fazila from Ministry of Health Malaysia. My question is about the cash just now, where asking online payment or e-payment and not accepting cash is a human rights violation. So how, at the same time, how do we, have society to be more digital savvy? So that is why we impose, you must pay, you must use e-payment or e-wallet and so forth. So how do we balance both human rights versus creating a digital society? Thank you.
Thanks very much. So we'll take a couple of questions and then we'll come back, and then I'll ask the entire panel to reflect on the questions. And just as I listen to your question, I'm thinking about my 90-year-old parents who don't know what a QR code is and who could not pay for anything digitally. So we talk about young people, but we're also leaving a lot of old people behind with this digital society and non-cash. Okay, we've got a question there. Wonderful. Thank you.
Thank you. My name's Carolyn Wallace from Vic Health in Australia. My question is to Meg. I'm wondering what's emerging from your Youth Digital Rights project in terms of are young people showing different expectations around standards of privacy, openness?
Interesting question. Any others? Okay, so let's take the two questions. I'm going to start with you, Osama, and then I'm also going to ask you guys to reflect on what makes for an effective regulatory framework, governance for digital technologies and AI as well. So,
yeah, so technology is for convenience, right? And also affordability. Service given by the government has a public service ethics and public service responsibility and accountability. So while we are saying that we cannot make a legislation which is either just digital, and we cannot make also legislation that without just technology just because you cannot afford it. But the point is that you have to embed the both together as a public service, embed both and make it more like public transportation. You are not saying that you can't have your own vehicle, but at the same time public transport is available. So that's the way. And health is a very serious public service. You cannot make it as an individual service, and you cannot make it also only for technology based. Therefore it is very, very important. So I would say it's all about legislation, it's all about ethics, it's all about intention, and how do you embed the rules and regulation. And I want to add, when we are working in an AI enabled environment and policy, AI is an extractive technology. It cannot live without data. Its job is to extract data from each one of you and every behavioral, social, every data. Then only it becomes functional to the best use. And that data, when you are taking from the people, that is where you have to apply ethics. What kind of data are you taking? Are you taking any permission? Do I know that these kind of data has been taken of my movements? For example, for the last 2 days of this conference, how much of movements here have been recorded in video and CCTV and going to be used for various kind of things? That how do you create a technological system to serve multi-dimensional, multi-colorful people in a conference? So how do you do that? But have you taken a permission of all the people who are participating here that we are being recorded and our data is going to be used, for various kind of things? So this is very, very important. Like yesterday's movie that you said that it was very, very beneficial. That was so precise that it looked like a real child. How do you make a real child, a person dancing in the evening, we couldn't make out whether it was a real dancer or a AI dancer. How? Because you extracted so much of data to put them to look like real. That is not possible without data. Data is the raw food for AI. And that comes from the people and our ecosystem. And that, so far, I don't see that ethics have been applied to that one.
I just want to pick up on this intention point, because that, for me, was very clear from that video yesterday morning, is that the intention of how we develop, how we regulate, how we train, and how we use the AI is up to us. And that's how you make it ethical and rights-based and people-centered. Let's go over to you.
I think how we can balance making everyone digital savvy and shifting from physical cash and all these things that are happening right now is really just empowering the people. I do understand, like even in my country, the government is coming up with all this new system right now, and everyone is complaining. If you've been following politics in Kenya, everyone is complaining because there's so much information that is being asked of us, but where is our information going to? Who requires it? What are they going to do with it? And I mean, we've talked about politicizing of data. The most important thing is ensuring that people understand why, for what, where, and how as well. These things will actually answer the question. I feel like people tend to be negative or resistant to change if they don't know why. But if you ensure that people understand this is why we are asking for e-payment, this is the reason, this is how you make an e-payment, provide those little things that seem little to someone who is digitally literate as such big things to someone who is not properly digitally literate. And I mean, interpreting that in different countries applies differently. So ensuring that people understand why are you asking for this information, why are you telling me to make an e-payment and 2 months ago I could pay cash, how do I make this e-payment, am I sure my card won't be stolen or hacked? I mean, those are some of the fears we have while navigating all these new digital spaces and digital advancements. So it's really empowering the people and also involving them in these processes. You cannot just wake up and say, I've come up with a new app. Everyone is going to make an appointment through an app. You know, how am I sure that this app is going to actually protect my information? So involving the people really places them at a point where they're able to trust, they're able to believe, and they're able to actually own this new amazing process, as opposed to the opposite of that, which always leads to people being aggressive or not interested, or they completely shut away from that process because, I mean, it's now your own process and not mine. Yeah.
And I'm going to come back later on to hear from you conceptions about privacy and informed consent. Because I think, you know, for the lawyers in the room and the human rights people, it means one thing, especially people of a certain age. But I hear young people, and I think this is our question from our colleague from Australia, young people perceive and I think interact with concepts of privacy and informed consent, especially on digital technologies, in a very different way. But let me come to Meg and then over to Dr. Gafour, please.
Yeah, thanks. Oh, there's so much I could say. I wish we were here all day. But anyway, yeah. I think this is just beautifully said the way you've just said it. I just want to add, sort of, when we think about data governance, one of the big challenges is resourcing implementation. So, you know, you can have a beautiful law and it's put into practice. But then if people don't know what the law says, they don't know what their rights are, they don't know where to complain if their data is breached, if officials don't actually know how to implement the law, and you have one person sitting in a data protection office who's responsible for upholding this for a whole country, as we see in some places, the law is not actually very robust. And so it's not just about having a good legal framework, though that's very important. And there are some groups here like Transform Health Coalition and Health AI that are working with countries and supporting them as they sort of think through how to do this. But the resourcing is crucial. I just want to come to this question of privacy and digital inclusion to say these are issues that affect people differently. So the need I may have for privacy and the need that Gerald may have and the need that someone else may have could all be very different. And what we see in our study is that it's a deeply intersectional challenge. That, you know, for people who are a little bit wealthier, a little bit more empowered, a little bit older, the needs for privacy are quite different than for a young person who's still living with their family, who may be sharing their phone with a sibling or a family member or a partner, and who may, if they want to pay for health services, then have that payment show up on their partner or their family member's statement, who might be saying, why were you at the abortion clinic and what was that all about? So, you know, I think these kinds of intersecting inequalities are really crucial to think about in the digital transformation. Thanks.
Thanks. Professor Gafour.
Yeah, I think to ensure that the digital transformation and AI used fairly in healthcare and ethically, it is strong regulatory approach must focus on key point. First, for example, personal data protection must be properly implemented following standards similar to those in other countries or in global countries. For example, AI should follow data protection principle. So like general data protection regulation in Europe, for example, or personal data protection law in Indonesia, it is again very important to build the trust to the society, both for the elderly, for the young, and for other. And it is important that to make sure that sensitive personal data stay safe, both so for the young and also for the elderly, for other groups. So make sure that all, before we develop the regulatory framework of the law, of course, through various type of debate, public debate, and, from the young, also from the elderly, from any type of societies. So the interest and the type of perception should be captured in the laws. And then second, adopting international data standard for interoperability, such as fast healthcare interoperability resources, is essential. This kind of initiative should be robust regulation from the government, especially in Indonesia from the Ministry of Health, that encourage the health industry to follow. And again, this allows healthcare data to be shared securely and efficiently across the healthcare system worldwide, and standardization have to ensure data quality and security while reducing obstacle to the international cooperation, and of course any type of the patient with their own characteristic can be fulfilled and can be protected. Thank you.
Thank you very much. And you've raised, I think, an interesting question around international standards and how in today's world, and I'm going to try not to sound cynical here, how do we get adherence to an agreement on international standards, let's say, for data privacy, data regulation? We live in a world where regulation has almost become a dirty word. In many sectors, in many sort of parts of the world, let's say. So the Europeans have incredible regulations around data, digital. Are those universally accepted? How do we get to international standards? Because this is these technologies are cross-border. So it seems to me that having a country-by-country approach perhaps is not the way to go, that we need some international standards. We have international standards in human rights, which are adhered to, should be adhered to by all member states, countries, governments, communities. How do we get to international standards, or is this not the time to get to international standards? I don't know, Meg, I'm going to ask you to start on that question. Probably should be having this discussion over a glass of something to drink, but
yeah, I think we might need that. So there is work being done on this by a number of institutions, and I know the UN Tech Envoy will be speaking later today, and we do have the Global Digital Compact, which sets a framework to have these kinds of conversations, which I think is really important step forward. But I do think there is something to be said for not trying to have a one-size-fits-all approach. While we need to uphold fundamental human rights standards and principles across regulation of tech, I was struck by the presentation at Rama Hospital by the gentleman who's leading the work on AI regulation in Thailand. He was saying, we don't want to rush into a law. We want to start by systematically in each sector, health, education, all across the board, developing guidelines, testing them out, developing toolkits, implementing them. And he had a real roadmap, which I thought was beautiful, to say, let's figure this out as we go. Because I think one thing that happens is we're talking about tech and AI as if it was one thing. it makes a vagueness, which is not necessarily helpful. Like there's so much specificity and there's so many different applications. So I do think there is something to be said for figuring it out step by step.
Really good observation, I think.
Yeah, one little input is that, once we make technology and we find that it is very convenient, we say that this is the way to go. I think there is one word called empathy. And there requires to, and this is for officials, like you said. I like the point that digital literacy or a digital capacity building among the service provider is more important than even the service seekers, because unless you have that empathy in the technology. I'll give you example. One of the databases in one of the estates in India declared about 100,000 people dead, and they were alive, right, for pensions. Right? Now, the officer is saying, go prove that you are alive. He's saying, I'm standing in front of you. So, and the guy is saying, but the technology is saying that you are dead. Because that Excel sheet or whatever is, so many times you didn't come to take the pension, and algorithm was such that if so many people haven't taken the pension for so many months or years, you don't exist or whatever. Now the technology is telling you that he's dead, and you are asking the person, prove that you are alive. So that is the reason I'm saying the empathy is very strong standardization and the base of treating technology to benefit people and not treating technology as an essential to exclude. Inclusion should be the very strong. Now, digital exclusion is the new term. I mean, digital is actually, if I am not there, then you are dead, or you are, that's where the human rights violations are coming.
Let me just ask Professor Gouffran if you want to come in, and then we'll see. Are there any other? My eyesight is failing.
No, I think international standardization is important. I think UNDP and other international agencies is, in my opinion, is a time, to compare each of the region and international standard is a time, I think, to develop. So that global cooperation is again important in creating and aligning AI regulation. Countries can share experiences, policies, and the best practices to prevent inconsistencies of regulation that could exclude a group of the people and could slow down innovation and global AI adoption. So working together also help to create a more inclusive and widely accepted guideline. So standardization, international standardization, again, is important. And we can start from ASEAN, for example, and also the world, and ensuring that the digital transformation, AI, and healthcare benefit everyone ethically and fairly. Thank you.
Thank you, and I think bringing your reflection together with Meg's about being very specific and being very deliberate and trying and building it from the bottom up across sectors, engaging people across sectors, even in issues around digital transformation across the health sector is super important. Whether it's the regulatory bodies or whether it's the Human Rights Commission, it's community groups. But learning by doing, I think, is really what you were saying, Meg, and I think that's a really practical approach. Last call for any questions. I think we have somebody coming up to a mic here. Please. And I see, really interestingly, that it's all the women who are asking questions. I think the men are very shy. Okay, please introduce yourself.
Good morning. I'm Indira from the Asia Center for Health Security. My question will touch upon how, Meg, you're doing a participatory research with the community, but often the evidence that's generated from those participatory research often may not be aligned with the economic or political agenda that's already set with AI development. So my question is, how do we align, or what steps needs to be taken both from the research side, but also from the government side and the private sector to make sure that when we develop AI, it is evidence-based, but also still trying to balance innovation with in pursuit of equitable health. Thank you.
Okay, thank you. We've got a couple of questions, so we'll take them because we're down to the last 5 minutes. Do I see some speakers over there, please?
Hello, I'm Nacha Saya from IFMSA Thailand, and
I'm Nishnipa Chawanpusit from IFMSA Thailand too.
so we kind of collaboratively came up with this question. So with the digitalization of communities, I know some communities still lack like basic infrastructures such as electricity and proper public service. How would the implementation of digitalization create a larger gap in these minority populations and the developing world? And would these populations prioritize basic necessities such as sanitation or access to public service over the technological development? And what initiative can we do to close these gaps?
Thank you. Excellent question. Is there one more back there that I can? Please, this will be the last one, and then.
Hello, I am Thanapat from Sirat Faculty of Medicine. So the question I want to ask is that that thing you mentioned about like international standardization for the regulation of technologies. I feel that the international regulation, like the standardization for all countries, it seems like I think impractical to me because all countries around the world like have different based off like their health system or and many things that involve maybe the different stakeholders, different regulators, and I think like also too much regulation of on the AI or the technologies, it could like limit the what we can do for the health system too. I also would like to know like is there any approach that is better than the international standardization of AI regulation, or there is something we could do like find the middle ground between each country? Thank you.
Thank you very much. Last question over here, and then.
All right. Hello. I'm Professor Ming Chen from Fujian Medical University, China. My question is about as for the informed consent. Do you think it's necessary we got the informed consent or broad informed consent from patient when we use the health stat, patient's historical medical records? Thank you very much.
Thanks very much. I'm going to take a page from Gabriel's book yesterday, and I'm going to suggest that this last round of questions, that the people asking the questions follow up with our panel during coffee break. And let me end with just a few reflections, summing up, I think, what has been an extraordinarily rich conversation. And I really want to thank the panelists. I mean, I think you've all been brilliant in highlighting the complexity, the breadth, and the depth of issues that we really need to consider. Principles, practices, examples, if we want to have an ethical, responsible rollout of digital technologies and AI. So let me try and sum up just a few of the concepts that I think that have been brought up. One is around fairness and bias mitigation. So maybe addressing existing inequities, not deepening them, being intentional about doing that, requires identifying and addressing the inequalities and the biases. Regular audits, checking how things are going. Maybe having metrics for fairness. How do we make sure that we continue to apply fairly? We talked a lot about transparency and what I'll call explainability or literacy at all levels, from the provider to the patients to the broader community. And how do we do that in a way that is understandable, that is open, and that we know that it's been understood. We don't just deliver it and then hope that they've got it. Accountability, clear lines of responsibility, human oversight, redress mechanisms, really important. I don't think we've talked about that too much, but I think super, super important. Privacy and data protection. We've, I think, unpacked some very interesting questions, really. I don't think we came up with lots of answers, but more questions to unpack around data minimization, informed consent, And I'd love to talk to the last person who asked the question about informed consent in the coffee break. Data security, super important. Societal impact, and not just impact to human beings, but also impact on the environment, on the climate. What is the benefit to society? How are we avoiding harm? And how do we make sure that it's inclusive development and deployment of technologies and AI and not just an extractive one-way process? Ethical governance and regulation. You talked about guidelines, and I think actually before we get to international regulation, the guidelines are very important, very timely, and something that we can learn from. Regulatory compliance, how do we ensure that compliance is something that we look at? Maybe review boards is something that we could think about. Sustainability, the environmental impact, the longer term effects, the energy footprint, which, certainly from the LLMs, like ChatGPT and things, the energy footprint is extensive. How are we going to manage that? And continuous monitoring and improvement. How do we monitor? How do we improve? And ethical training, which I think is a huge gap. We have a lot of training that is disciplinary in terms of, discipline specific, I should say, not disciplinary. Health training, training on digital, but we also need the training on ethics and the training on human rights. Something, Darup, that you brought up and that came up across some of the comments is the engagement of different sectors, the cross-disciplinary, cross-sectoral, very important. And I'll end on, because I work for the United Nations, on global cooperation. I think it's really important. We have a huge opportunity with this digital compact, which was adopted as part of the Pact for the Future by member states at the UN last September. So let's use that to really make sure that we can drive a model of inclusive, ethical cooperation to make sure, coming back to that video that we saw yesterday, that we are driving with our intention the use of this technology and not the other way around. So please join me in a round of applause for the panel. I think they've been excellent. Thank you.